All right. Sorry, I have my computer up too, so I could like see the chat and stuff. All right, I guess we can get started then since we have everybody that's on the panel now. So basically I can just start introducing myself and then I'll have the other three panelists introduce themselves as well. And then I have like a list of basic application type questions, and then we can leave maybe 10 to 15 minutes at the end if there's any additional questions. So for me, my name is Mariama Evans. I'm a PGY 5 now at UNC Hospitals in Chapel Hill, and I'm doing a fellowship training in blood banking and transfusion medicine. And I'm originally from Chicago, and that's pretty much it for me. Whoever else on the panel wants to go can go next.
All right, I'll go next. My name is Hannah Wong. I'm a microbiology fellow at Stanford, and I just graduated in June from a combined anatomic and clinical pathology residency program here as well.
Hi, should I go next? Okay. So I'm Evelise Suarez. I am currently attending at NYU. I'm a gastrointestinal pathologist. I've been at NYU for, this is my 5th year. And I guess since we're talking about residencies, I did a residency APCP at Mount Sinai Hospital in New York. And then I did a Surg-Onc fellowship at Memorial Sloan Kettering, and then I did a GI fellowship at back at Mount Sinai Hospital. So any questions about residency, I should be able to answer. And prior to being at NYU, I was also at Tufts University. So I've been at very large programs and at very small programs too. So everyone welcome.
I guess I can go next.
Yep, you're the last one.
Okay. Hi, guys. I'm Olga Yaffe. I'm an anatomic surgical pathologist specializing in breast and GYN pathology. I'm at University of Maryland, where I did my residency in anatomic and clinical pathology, and then a surgical pathology fellowship with focus in breast and GYN. So, and I've been a program director for many, many years at Maryland. And now I'm vice chair for education, so also responsible for medical student education as well. So very passionate about education, both for medical students and residents.
Great, thanks. And if at any point my mic or any internet or anything is acting weird, just let me know and I can try and fix that. It looks like everybody that's not on the panel is muted, but just a reminder to make sure that you're muted if you're not speaking. For the first question that we had, it was what traits do you look for in a resident, and what traits make a pathology resident most successful?
I guess I can go first. Having interviewed and looked at applicants for so many years, we mainly look at people that are good team players, that are honest, and also fun to be around, and kind of well-rounded people with interests outside of pathology as well. We love people who we sometimes look for people who haven't been to our area, or sometimes they have ties to the area where we are. Just very, people representing various areas of the country and various subsets of to have a very diverse program. So right now we have a very, very diverse program, and so we're looking to keep it that way.
Great. Does anyone else have anything else they want to add?
Yeah, sure. I'll echo basically everything that Olga said. I'll just also add that for our program, we look for the same thing too. A lot of times it's not just about test scores. A lot of it is personality and how you come across in the interview. Like we want our residents to all get along with each other, and we want to get along with the residents as well. So we really, I mean, it sounds bad, but we really do look at personality and how enthusiastic you are in the interviews. You know, do you ask pertinent questions? Really, like your enthusiasm really can sell you. So I highly suggest when you do interview to, you know, show your enthusiasm for the field, because it can really impress the interviewer. Anyone else have anything to add?
Yeah, I actually agree with that, that being a team player definitely helps somebody stand out in the best way possible. I don't have anything else to add. I'm not sure if Hannah, if you do, or if you want me to go to the next question.
Yeah, just briefly, very much the same thing, but more from a perspective of having personally been through the process more recently. I would say one of the things that I felt programs were really looking for is a why, like why pathology and then why my program. So my advice is to really approach your interview with those questions answered in your mind, because that's going to come up in every discussion. So whether it is a fellowship that they offer or a person there that's, you know, you're really excited about their work or something like that, just try to have something that, you know, really makes that institution stand out as somewhere you want to be.
Yeah, I think I just wanted, if I may, to just add to what Hannah said, that reminded me of the other very important thing we look for is that the person, the applicant, knows what they're going into, understands what pathology is, and asks very important questions and very pertinent questions. And it's easy. You can just, you know, read stuff online, talk to residents in different programs, or talk to your friends, but you know, and also we look for people who have done rotations in pathology or have sufficiently explored the specialty to the point of knowing very well what they're getting into, because this specialty is awesome. Of course, that's why all the panelists are here. It's used to be the best kept secret, right? But we definitely, but having said that, it's very different from what the students experience in their senior years, in their clinical years. And so we want you to know what you're getting into and be very well informed.
So similar to that, the next question that I had was how to stand out in a virtual interview setting, and what should you do to prepare for virtual interviews?
So I would highly recommend, first of all, preparing your space that you're going to be doing your virtual interview on. I see some of you are like really well dressed, really well lit. You clearly have thought about kind of your background and all of that. So that's great. And I would say maybe just try to invest in some, whether it is like being in front of a window that has, you know, some light, or maybe arranging with your medical school, like to get a room or something like that that's well lit if you're not able to get that at home. I think that makes a big difference, unfortunately. So that's one aspect. And then the other thing I would say, I think it's really hard to make those personal connections the same way on Zoom that it is in person. But I think ultimately that's the thing that people remember. And I would say I approach interviews with the idea that like my goal is to like find one connection with that person I'm interviewing with, something I have in common with them, or something, you know, that I want to know more about them or something. And if you can kind of try to make that personal connection with the person on the other side of the screen, I think if you approach it that way, that's my like number one advice. And that brings a little more I don't know, humanity to the interaction rather than just kind of question answer.
Yeah, I think, the most important part of the interview before the virtual world was to connect, was connecting with the residents and connecting with current trainees. And in some programs, trainees actually participate in the process very actively. In our program, they participate in ranking. So we give them a lot of power, and it's a very, they have a lot of say in our program. But in a virtual interview, it's going to be more difficult, but you will have, in most virtual interviews, you will have segments of the interview that you will be talking to at least some trainees, hopefully, right? If you don't have trainees there, that's going to potentially be a red flag, right? That if the program doesn't want you to see their residents. And so when you talk to the residents, like Hannah said, try to make a connection. They will be very welcoming, most likely. So just try to make a personal connection. Try to make them your advocates in the program.
Hi, and I'll also add to the virtual interviews. Please be dressed appropriately, business attire. Some people think because it's virtual, they could be more casual, but I still expect the applicant to still be dressed appropriately, because I will be dressed appropriately in business attire. So yeah, I still expect for you to look like you're you're applying for an interview, you're applying for a position. So yes, please be dressed appropriately. And also, as far as background, I have noticed, like, if someone has some kind of artwork in the background, some kind of or books, like favorite books that they have. I'm a pathologist, so I see everything. So I do ask about, oh, what's that artwork? Oh, what's that book you're reading? Did you read it? So stuff like that, that's a little personal, could also be a nice touch. It could be a conversation starter. So that's another way to kind of stand out too.
I wouldn't mind if somebody's cat walked across in the back. That would definitely be memorable for me.
Similar to what Hannah said earlier, the only other thing I had to add was just like, for me, I would usually look up the people that I was going to be interviewing with. Like usually you'll get an itinerary, and that would just be helpful as far as like maintaining a conversation, what subspecialty they're in or what their research is. And that was very helpful as far as establishing rapport and things like that. For the next question, it was what to look for in a program, also like how to decide, and then how we briefly touched on, are there any red flags to look out for? Not meeting residents is definitely a red flag, I agree.
I guess I'll start with this question. So when you're looking at interviews, you definitely want to speak to the residents, ask them what their normal, an average day looks like. Are they able to read? Are they able to preview their cases? Is there teaching at the scope? How is the teaching at the scope? You want to ask, how is grossing? Do you get assistance? Are you supervised? Is there PA that assists you? Who is teaching you grossing? What is the cycle when it comes to your major rotations? You want to be able to preview, as well as be able to write up your cases. So you also want to see what's the distribution of cases. Some big programs, like the interesting cases, go to the fellow first. So you want to see, as a resident, do you get to see the interesting cases? Do you get to see consult cases? So you do want to see, what is the breadth of material that you'll be able to see. And then as far as red flags, you want to see if the residents look really tired, having bags underneath their eyes, that's a red flag. Are their eyes red? And you know, do the residents seem happy? You want to ask, how do they do on their boards? A lot of people forget to ask that. I didn't, and I wish I had. So board passing rates, where do the graduates end up going? You know, if the graduates are not going to places that you don't want to go to, you know, that's might be a red flag for you. And let's see, other red flags would be, you know, are you able to publish? Like, unfortunately, once you get into residency, then you almost immediately have to start thinking about fellowship. And to get a fellowship, you need to show some kind of publication, some kind of contribution to the field. So you want to see what kind of publications the residents are able to do too. And then if anyone else wants to add to that.
Those all were absolutely excellent, right on the money. I want to add, if you want to ask how the residents socialize, if they like to hang out together, if they do things for fun together, if it's so kind of you want to get a handle. It's difficult on virtual, you know, obviously on Zoom, but if you have a sense of a cohesive group there, what are the relationships between attendings and residents? Is it formal? It's going to be, you know, the taste of the program is going to be obviously a little bit muted because you're on Zoom, but you want to see, you know, everybody has their own taste and their own preferences, just like looking at colleges. Some people feel good in a large campus with a lot of people. So there are some larger programs and a lot of attendings you get. So there are benefits to that, where you have exposure to multiple faculty and a lot more options. Or medium programs have, you know, sometimes people say it's like a golden middle where you have a good variety of faculty, but it feels more like a family where people are taken care of, that there's a lot of mentoring, you know, and the residents are really looked after and taken care of, and there's a cohesive group. So, but you know, residents flourish in both kinds of settings. You just have to know what is right for you. So developing, and that can only develop after you interview at several programs of different types. But in terms of oh, I lost my thread. I had several more things. Oh yeah, what actually Ibelis, right? Ibelis. Yeah. What Ibelis mentioned,
Ibelis.
Dr. Suarez mentioned, is super important. I always tell my students, absolutely always ask about preview time. If you have enough time to preview and read about your cases, and you know what you're carefully ask about your the duty hours, with you know, kind of you can gather from what Dr. Suarez was asking, was saying, whether they look tired and underslept, overworked, whether there are days that help them gross, or they, you know, in like old days, the residents would gross in some programs. I don't think now it happens much, but in the old days, you guys all heard legends, residents grossing till midnight or 1 a.m. I don't think, yes, I heard, I know. All right, but you want to see if the program does not depend on residents for grossing, if they have PAs to gross, if the residents focus on difficult cases, on interesting cases. And I wanted to also tell you that one thing, looking at preview time, but also looking at the volume, again, going to the size of the place. It's probably like a bell curve. Very small programs with less than 12 residents and small volumes are probably not ideal. very large programs with very high volume, it doesn't always mean that you will see more cases. Like Dr. Suarez referred to, cases can get distributed out to fellows, to different pathologists, and you may not necessarily see a lot if the program has a lot of cases. You want to see that the cases go to residents primarily, and they have enough preview time, because if you just get cases but you don't have time to read about them, it's not so useful. It's just going to be busy work. So you want to benefit from the cases, but preview time is a litmus test as to how the program is committed to the education and stands their ground in terms of not letting turnaround time dictate education. So those are my 2 cents.
Anything else?
Oh, I don't have a lot to add to that, but to all of the things they talked about for what you look for in a program. But I just want to add one more thing, which is evaluating kind of your personal life and how that's going to fit in with the residency program. So one thing that, you know, for me, I didn't realize how important it was, but was really access to healthcare, and also not just physical healthcare, but also mental health care. So that is something that I would say really look into, like the brochures and stuff about benefits, if that's something important to you, and talk to the residents if you can, if you feel comfortable about, like, are they able to take time to go to a doctor's appointment or something like that? Because a program where residents feel like they have to take vacation time to go to the doctor, that's kind of gives you a sense for the priorities of the program. So I feel that to me is a little bit of a red flag.
I agree with that as well. The next question, since we're talking about surgical pathology, what are the benefits versus downsides of multiple day sign out, like 3 or 4 day sign out versus a single day sign out in surgical pathology? I can speak to my program since we're a single day sign out. So essentially, we do sign out from 9 to 12, and then lunch is 12 to 1, or your free period, whatever you want to do with that. And then residents will gross from about 1 until whenever they finish, which depending on what level year you on is usually between 3 and 4:30, and then preview after that. So we pretty much do everything every day, and it kind of breaks up the day. I don't really know what the downsides would be. If you're somebody that wants to only do one thing all day, then you probably wouldn't like a single day sign out. But I think it's pretty manageable in at least in my program, and people generally don't stay very late.
I will say I also have a 1 day sign out at our program, and I think it totally depends on your personality and learning style, what's going to work for you. And I think ultimately you're not going to know until you're in it. So I feel like it's very hard to make a decision just based on that. I will say I love the 1 day sign out cycle, because I feel like I get more opportunity for feedback and more opportunity for improvement. So rather than seeing my attending, you know, once every 3 days, I see them every day, and I can take the feedback that I get and immediately make an incremental improvement in the next, you know, load of cases or the next thing I gross. So that to me is a plus of the 1 day cycle that I don't think a lot of people talk about.
We have definitely, but I have to say, you adapt to whatever cycle you have. People look very carefully whether programs have 1 day sign out or 3 day or 4 day. There are all kinds of setups. Sometimes be careful that those 1 day sign outs also have autopsy added, and the residents can be pulled if there is an autopsy, and it can get pretty busy until you're very, very efficient. You can run out of time very quickly. That actually reminds me to I don't know, Mariama, if you have a next question about subspecialty sign out versus general, but.
No, I forgot to add that one, but we can talk about
that.
So
we can touch on that too, because that kind of relates, the cycle of sign out relates to subspecialty versus general sign out, and it's definitely, I have to say, both of them have pluses and minuses, like everything, like different schedule, for example. having a subspecialty sign out can be awesome. You have exposure to specialists. It's much more efficient. You will learn better, but then you will not see this one system. Like, for example, GYN, you will sign out for a week and then not see GYN until maybe next year or several months from now, as opposed to seeing it on an ongoing, but some bread and butter cases on an ongoing basis and developing good level of comfort with them. So there are pluses and minuses in both. The important thing is that you have a program that looks after your development, making sure you have, you're growing in and learning in every field, and making sure that there are any deficiencies that are addressed and kind of in a dynamic way. So it's both of these can work very well, depending on your learning style. So it's not, those are not make or break things. The preview time, I think, and making sure the residents have time to read and learn are more critical than what actual cycle or what kind of sign out.
I've been at hospitals that have both general and subspecialty sign out, and there's positives and negatives to both. My personal feel is when you're first starting, a general sign out is actually kind of nice because you get exposed to everything. You get exposed to GYN, GI all at the same time. And as I said earlier, applications for fellowships keep coming earlier and earlier. So you do want to be exposed in the very beginning to a broad range of specimens. That way you could kind of figure out what it is that you might be drawn to. So in that way, general is sometimes nice in the beginning, or some kind of exposure to general sign out. At NYU, we have both because the residents rotate at different hospitals. So at one hospital, they do have the general sign out, but when they come to Tisch Hospital, they have a subspecialty sign out. And sometimes it's more of the like the second years and above that have the subspecialty sign out. So you know a little bit more. So you're able to go into the subject a little bit more in depth, as opposed to just kind of seeing like the surface of everything. So yeah, I think both approaches have their positives and negatives. And I think it would probably be advantageous to be at a program that exposes you to both. Whether it is in 1 year you do general and the second year it's more subspecialized, or you rotate at different hospitals. Rotating at different hospitals for me was, I really liked it because each different hospital has a different patient population. So I was able to see different spectrums of diseases, and yeah, different populations just have different kinds of specimens and entities. So yeah, I don't really see complete positives or complete negatives to either one of those. It's really just different learning styles.
Actually, you reminded me, Dr. Suarez, about one thing to look for. I started saying that, and then of course, being old, I lost my train of thought about the volume. So it's not the volume. I started saying it's a bell curve. You want to see not necessarily a high volume, but a good range of conditions and diseases that the hospital where you are training is seeing. So that is difficult to gauge on your end, but you can gauge it by looking at the maybe website of the program and seeing, for example, is it associated with a large cancer center? Is it like, for example, our program is associated, we have Red Cross and Institute of Virology and a huge shock trauma center and a huge HIV and transplant population. So all of those drive variety, not necessarily in tumor variety, but variety of exposures, both in anatomic and clinical pathology. I'm not saying that this is unique to us. All of the big academic centers will have, or most of the big academic centers will have those things that drive variety. So having a high volume may sometimes just make you more tired and make, have stay longer hours, but having variety will make you learn more.
All right, the next question is, has the COVID pandemic changed your clinical practice or resident education?
Hannah, were you gonna go? Go.
I'm just gonna say, and as a resident having experienced this, I think it very much depends on where you were in the country and kind of what the demands were at your hospital. I know colleagues that have had to, go to the wards and actually practice real medicine, and on the flip side, I feel that, in our department, what actually happened was that we were in the middle of this long, slow, painful transition to digital pathology. And it was actually COVID that made us make that switch. And so overall, I think my education actually, thinking back, it was incredible the amount of stuff I was able to see because all the cases got scanned. So I was able to learn a lot through being able to see the volume of cases from other people. So that it was like unexpected how that, actually helped my learning. So I would say it's kind of a mixed bag. The only thing I would say is that, ask about and think about how the program treated their residents during COVID and how they protected them or didn't protect them or made accommodations or didn't make accommodations for them. Our program was incredibly generous in terms of allowing people that, to first work from home, and then as we transitioned back to in person, if there were people with children or childcare needs, made all sorts of accommodations for them. And so, I think it just speaks to mostly the culture of an institution. And I think you get really a good sense of that culture by asking these concrete questions of what happened during COVID.
That's an excellent point. Yeah, we also protected our residents and let them work from home and gave them assignments to work from home, and also expanded digital pathology. Actually, Hannah, that you reminded me, this is where things are going in that direction. So you ask programs if they have any telepathology, digital pathology in their program, how much do they use it? What do they use it for? How long have they been using it? How comfortable are they? So you will see a huge range. I mean, it's not that important to you now, but it just, again, tells about how forward-looking the program is. But definitely about going back to COVID, allowing residents to accommodate all of their situation, but also we had residents who participated in validation of rapid tests. Trained student helps medical students volunteer during COVID. So we didn't send them on the wards, but they were helpful in so many other ways in the clinical labs mostly.
Well, for us, we're in New York, so we were the first hit. So a lot of our residents and fellows were participating in the lab. A lot of them were, we call them part of the COVID army. So they were the ones in the lab doing a lot of the testing, the validations. A lot of the residents did participate in the research of the COVID tests and had papers and abstracts written about their experience testing for COVID and the rapid testing that was performed. And when I guess the peak started kind of lowering, the residents were being taught on WebEx. So most of the attendings had cameras and on our microscopes, and we would go over cases. The residents would preview the cases first, leave it in our box, and then we would go and take the cases, review them via WebEx. So it kind of wasn't that different because they're still seeing what I'm seeing with the WebEx. So we were still able to kind of go over slides. They were still able to preview. They were still able to, you know, get some kind of education, or at least I like to think that we gave them some kind of education. But it has prompted us to also look at digital pathology. So in some ways there are, I guess, ways that COVID has kind of prompted us to kind of use the technology that was available that we just never, I think a lot of programs just haven't used, but COVID kind of kind of forced us to use. I mean, just like Zoom, like most people haven't used Zoom, but it was always there. We just were never forced to use it. And now I've had family gatherings with Zoom, which we never thought of. And all our meetings now are still online with Zoom or WebEx. So yeah, it's forced a technology upon us that would probably help us in the long run. I do think with digital pathology, it might be possible for us to work from home. So that would be nice too. So yeah, I do agree with what everyone else said before. How people were treated during COVID, during the peak, says a lot about the program.
That's interesting, because we've done for so many years, we've done all of our known conferences on telepathology on scanned slides. So we've been scanning slides for at least 10 years. So that has not changed. So we were just able to do those same telepathology conferences on unknown, like unknown slides or any other slides on Apereo. So we didn't have to adapt much for that. But I'm glad you guys are discovering the benefits.
All right, so the last question that I have is how many programs do I need to apply to or rank? And I don't know if this has changed now that virtual interviews and all of that, but I can just say I probably maybe interviewed at 13 or 14, but that is probably even excessive and not necessary. But usually what I hear people say is like 10 to 14. There may be other opinions on that as well.
In the past, I would tell my students to apply to around that, between 10 to 15, depending on how restricted you are geographically, and you know what your other preferences are, what your family situation is, and what kind of programs. You know, there's some students, for example, I have one student a year, and currently now, Hannah, I wanted to introduce them to you because they're looking for their MD PhD, looking for microbiology program. So they want to get all the information they can. But so that depends on if they're open or if they have a field already selected. Some residents or some students are looking for forensic medicine. There's more and more of those. And so thanks, Hannah. But I would say because you're online, the virtual interviews now allow you to interview at however many programs you want to. That really, you know, in the past you had to be judicious because it would cost money, right? So now you can interview and explore, and the programs are aware that applicants are interviewing at more programs.
Yeah, I also agree. I think 14, 15 is probably appropriate. But again, one thing that came with COVID is these virtual interviews, and in a lot of ways it's kind of democratized interviews because financial means to travel is no longer really hampers anymore. So, I mean, something good came out of COVID is this interview process is a little bit more, a little bit more of a level playing field.
Absolutely. Yeah, we're very happy about that.
Hannah, did you have anything else to add before I open the floor for questions?
Nothing to add. I think everybody covered it pretty much. I agree with the 14, 15 range is a good
Okay.
one.
All right, well, if there's any additional questions that the applicants that are here have, you can unmute yourself and go ahead.
Hey guys, I just want to say thanks, first of all, for all the information that you've given us. It was super helpful. So I have a question, not too concentrated on the whole Zoom aspect, but for interviewing in general, as a resident or as an attending who's interviewing, what are some red flags for the applicants, I guess, besides, visual appeal on Zoom, the whole background thing? Besides that, what are some things that maybe we don't think about or we might say inadvertently that could be red flags for you guys?
I have one, not being familiar with your application, and your extracurricular activities and research and things like that. Like, you should be able to have a conversation about them, without any real difficulty. And also just knowing what pathology is and what we do and having a sense of the field, as was mentioned earlier.
I think also being aware, I think it's much harder now with Zoom because there's like a certain amount of awkwardness, but being aware like of how much space you're taking up and that you're coming across, interested in a good way, but also not kind of dominating like those sort of social or group conversations you might have with residents, or if you have a panel interview, I doubt it now with Zoom, but that is something that I look for when I interact with interviewees kind of in a group basis on Zoom or back then in person as well. It's just how you treat the other co-applicants and respect their space and time.
That's an excellent point, but also not being too quiet, because it was even possible in person, but on Zoom, it's going to be very easy to get lost and overshadowed by other people. And you want to be remembered by the smart questions, by well-informed questions you asked, by, how much you laughed, how much, how you reacted naturally and try to connect with people. So just be yourself. I think don't try too hard, but be informed about what pathology is. You don't have to ask a lot of questions, but ask a couple of good questions. We all know everybody asks the same kind of questions, like is the program going to change? Where do you see your program in the future? Or, some like very vanilla questions, which are important too, but also ask some probing questions like preview time would be a good one, for example, subspecialty versus not board exams, what fellowships the residents could get into, what kind of practice do they go? Do they all go into academics or go into private practice? What is the range of different settings?
And I'll just add, a lot of times with pathology, we get a lot of applicants who aren't really into pathology. They are more like, oh, it's a backup plan, because they don't want to not match, or like it's just something that they'll see if they don't get anything else. So sometimes that can come across during interviews, like if you don't know, why you're going into pathology. A lot of people have some kind of some kind of story as to why they want to choose pathology, some kind of inspiration. So with residents that, or applicants that don't have like that true desire to be pathologists, sometimes that comes out as a red flag, and we can sense that if it's just like, you're just like, we'll see where I land. That for me is another red flag, when an applicant is just kind of like, it seems cool. That to me is a turn off. Let's see, other red flags would be not being able to communicate properly. And I'm not talking about accents or anything. I'm talking about just expressing yourself, because as pathologists, a lot of people don't realize that, okay, we don't see patients, but we are very prominent in our tumor boards. We do a lot of presentations. We do a lot of teaching and interacting with other clinicians. So communication is extremely important. So, you know, do practice interviews, figure out what it is that you want to say. I would definitely just maybe sit in front of a mirror and just see how you're coming across, and just run over some practice questions, and just so that you're not surprised with anything. Okay.
Yeah, I think you are guaranteed to be asked by almost every faculty member that interviews you, to be asked, how did you discover pathology? How did you decide? And those paths are going to be very different, but you have to be genuine, right? And you have to have a sufficient amount of detail to provide to actually convince them that you actually explored and you know what it is, that you chose pathology knowing what you're getting into. Asking, so in response, you can ask them very informed questions, like what is the cycle of sign up? You can ask the residents good questions, like how often are they on call? Do they have to come in? Or they read the Frozen's on telepathology just like us, without having to come into the hospital. So, just asking those specific questions. How many abstracts do your residents submitted to USCAP, for example, which is our biggest conference. So asking questions that show them that you've learned about pathology, that you know pathology. Oh, one thing I wanted to say, one red flag would be to say, if they ask you why you chose pathology, is to say, I don't want to see patients. I don't like patients. That's not a good response, because we do see patients, and even if we don't see patients directly, some of us do. Like I do fine needle aspiration biopsies, and people in blood bank see patients all the time, but and other situations, but we serve patients in many other ways, so that's not a good response.
Thank you so much. That was very helpful.
Hi, I'm Mahalia Robinson. One quick question that I have is, as a resident, are there any opportunities to teach, like on the, I guess, like medical students?
That would be a great question to ask, because you will have a variety of settings in different programs. In some programs, you don't teach until you're more senior. In some programs, you don't teach much. In most of the programs, you will be teaching medical students, PA, if the program has a PA program, PA students. When you become senior resident, you will be teaching your junior residents. Like we have a babysitter, it's called a babysitters club, where we have a senior residents specifically training junior residents for several months and not letting them out of their field of vision for a minute. So definitely that's a very good question to ask, and also to showcase, to say, I'm asking because I love teaching. And so that will make you stand out and make the program interested in you.
Thank you.
Totally agree. Great question to ask during interviews. And I would say there's a vast, a wide array, like Dr. Ayofi was saying, of options. Like one option, for example, at Stanford, is there's actually this sort of like course you can take on the evenings. It's via Zoom now, but you can kind of get accredited, get some certification in medical education. And this is actually not limited to medical education. There's also other types of courses in like global health or diversity, equity, inclusion, leadership, and things like that. And that's also something like as an add-on to your question about are there opportunities to teach medical students? I think that would be another great thing to ask is if any of you have ancillary interests kind of in these topics to see if there's other training and courses available to you.
Yeah, you would definitely stand out if you asked me that question. Because as pathologists, we do a lot of teaching. Most residency programs, you do some kind of teaching, instruction of medical students or other residents. I think having the desire to teach just shows your interest in the field and your desire to communicate what you've learned. It just shows some kind of enthusiasm for pathology, which I think is very important. And I think a good pathologist does teach, no matter what kind of setting you're in. If you're in academia, definitely. But even in the private setting, the clinicians are going to ask you, what does this mean? Is this benign? Is this malignant? What should I tell my patients? So, we are still the doctor's doctor. So we need to know everything, unfortunately. And we need to communicate and sometimes educate our fellow clinicians as to like what things mean and what does it mean when I say this in particular. So yeah, teaching is a very important component of what it is to be a pathologist.
Thank
That
you.
just reminded me, well, what you was saying just reminded me of one thing that we didn't touch on, which is like being able to demonstrate that you have good written communication, because we do so many notes and reports and things like that. You definitely want to make sure that your application has been proofread and spell checked and all of that, because that's a big part of what we do as well. Were there any other questions?
Yeah. Hi. My name is Carlos, and I have a couple of questions. What will be your recommendation for a non-traditional IMG, as known as old IMG, besides this course? What do you think can improve the curriculum of non-traditional IMG? And also my second question is, if you can turn back time to the moment before applying to pathology residency, what would you do? Would you do the same? What would you change?
What was the first question? Can you repeat the first question again?
Oh yeah, sorry. What would your recommendation for a non-traditional IMGs, like as known as old IMGs, like beside this course, what would you think can improve a curriculum for a non-traditional IMG? And the second question, you want me to repeat the second question?
No, it was just the first one.
Okay.
So do you mean like how to be, I guess, marketable to programs, or?
Yeah, because I read a little bit about like there is a cutoff for some programs, like 5 years or 8 years. And some programs like don't consider old IMGs or non-traditional IMGs. And like besides having a good scores or good scores, what would you recommend to improve like research, doing something else in preparing for applying for the residency? I'm going to apply it next year, not this year. So like will be a good time to do something different or preparing it in other way, like to have like a better curriculum for the next application season.
I don't know if this is necessarily applicable to specifically a non-traditional IMG, but I would say that we do get a lot of non-traditional applicants in pathology as well as, IMGs. And I would say one of the things that is asked and looked for is really kind of, again, that why pathology, after everything, if you're a non-traditional, what life experiences have you had? What sort of other training have you had? And what really led you, through all of that to pathology, and trying to communicate through your actions or through kind of a good explanation of how you basically arrived at this decision. And I think programs just want to know that you're committed, that you're gonna, take the training seriously, and that it's not just like a placeholder before kind of your next move. So that's kind of my advice there. And then just generally in terms of making yourself more competitive, if you have the time and the resources, would be to, if you have specific programs you're interested in, would be to, some programs are doing rotations now. So for example, at Stanford, we have this away rotation, and we have a program kind of where if you qualify, you can be set up with housing and all of this stuff. And so I think, either looking at doing a research experience at an institution that you're interested in to meet people, or if you're able to do a formal kind of rotation, actual medical student rotation for the non kind of IMG or not more traditional pathway, I think would be a good way to show interest in a specific program.
Yeah,
Thank you.
COVID has changed things. In the past, we would say doing a rotation and getting letters of recommendation from a program where you did a rotation, that we could recognize that you were able to function, and people enjoyed having you around in their department. These days, some programs offer virtual rotations. So try to take advantage of those, and I think participate in maybe a project with a pathologist. We generally don't look really, I don't know if you guys can correct me, but like our program, we don't really look for letters of recommendation from other specialties. We really only care about letters from pathologists. I tell my medical students who apply to pathology to only get letters from pathology, because that's what we care about and want to hear from other pathologists how they interacted with you. So trying to rotate somewhere, whether virtually or in person, and getting letters of recommendation and doing projects with them, I think is what I would recommend.
Yeah, I also echo everything that everyone else has said. I think observership or some kind of research with someone in pathology would be beneficial. Because again, if you're doing something like in medicine, internal medicine and whatnot, I'll start thinking, okay, are they really devoted to becoming a pathologist, or, do they really want to be an internal med, and just, if that doesn't work out, then they'll be a pathologist. So yeah, I would definitely concentrate on either the location, the city, wherever you want to be, but ideally the program that you would like to be at. And then I think you had a second part of your question, which was, what would you do over again when applying?
Yeah, thank you for that. Well, yeah, if you can like turn back time to the moment before applying to the pathology residency, what would you do? Like, what would you change at this point? Like, what is everything that you know about like the process and everything?
Yeah, I mean, my decision to go into pathology was pretty late. I did do 2 electives in pathology. So I felt like with those 2 pathology electives, I thought I knew what it was I was getting into. But I think I wished I would have looked at like the different subspecialties, how different programs operate. Oh, before I forget, ask about on-call schedules. Ask, do you have the 2 a.m. calls? Because my residency did, and I didn't ask about that. I didn't know about that. So I would just probably look into asking more specific questions about the daily life of the resident. Because when I was on interviews, I of course asked, but I guess I didn't go into details, like how much preview time do you have? That's not something I thought was really important. I thought, oh, you just look at the slides, and like when you're doing an elective, everything seems so easy. Like a pathology just seems so simple. Like, oh, you just look at the slides and you have a diagnosis. But if I could turn back time, I think I would want to be a little bit more specific with the daily schedules, and what is expected of me as a resident. And I also wish I would have asked about like publications and abstracts, and how often are residents involved in academic papers, because that does really help for you to get your residencies. And also it's a good experience too, just learning how to write a proper paper.
To add to that, also with regarding daily life, I think one good thing to ask is, what time do most residents come in, and what time do they leave as well? Because that will give you a good sense of what their everyday life is like. And especially when you integrate call into that, kind of like, well, what happens if you have a long night on call? Do you still come in, or do you take a few hours off? And kind of things like that that you don't know about until you're already kind of in residency. But those are all good things to ask about.
Yeah,
And
absolutely.
kind of related.
Yeah.
Oh,
Go ahead.
sorry, I was just going to say, related to that, also, I think it's important to ask kind of what the attending schedules are. And you really, if a place when the residents or the trainees and the attending schedule aren't aligned, I think that is sort of maybe a red flag. If the residents are leaving super early and the attendings are there till 10 p.m., that tells you that the residents really aren't part of, they may be just observing. They're not like responsible for the cases. They don't have the opportunity to write them up. They're not really getting to learn as much as they could. Conversely, if the attendings are they're late and the residents are there late, I think that tells you a lot about the culture, right? If both leave, at a reasonable time, I think that's what you're looking for. And then if the attendings leave super early and the residents leave really late, that's a signal of a sort of malignant place.
Yeah. We anecdotally, we all heard about programs where you were considered lazy if you left before 10 p.m. But I don't think there's many programs like that anymore, but just try to find out. I think the best people for you to talk to before you interview are the residents in your own institution where you have done, hopefully you've done elective rotations. Ask the residents, because they've just gone through the process of interviews and selecting a program. Ask them those same questions, like what should you ask? What have they learned now that they would have done differently? So that was actually a very good question. Thank you, Carlos.
All right,
Oh,
so
thank
it's
you.
it's 8:03, so I guess we can stop here. I'm gonna put my email address in the chat, and anybody else who wants to as well can, just in case any other questions come up after the fact. And definitely big thank you to our panelists for dropping all this great knowledge for everybody. Let's see. All right. Thank you, everybody.
It was so nice to meet you all. Good luck.
Thank you.
Bye.
Yeah, good luck,
Good luck, have fun.
everyone.
Pathology interviews are not malignant and should not be stressful. Remember, you are shopping, not the program is selecting you. You are shopping around and selecting the program. You're the asset. So make sure you show your positive sides and the programs will be choosing you and not the other way around. Remember that.
Exactly. All right.
All right. Thank you.
Bye, everyone.
All right.
Bye.
Thank
Thank
you.
you.